Welcome to episode 2, Grape Seed Extract for people with diabetes. Today we're going to be discussing the number of things grape seed extract can do for you if you have diabetes, including improving your circulation, your heart health, your blood pressure, possibly even reducing the plaque in your arteries, a natural bypass, kidney health, and vision. Hi, my name is Jerry Hickey. I'm a licensed pharmacist who also has studied nutrition. I'm over here at Invite Health, and I'm also the scientific director, and I'd like to talk to you today about the many good things grapeseed extract can help with in people with diabetes. So please be sure to subscribe to our Invite Health podcast, and please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. And all of the information on today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more information. So let's get going. At the end of the last episode, episode 1 of grapeseed extract for people with diabetes, I discussed a study from the University of Alberta up in Canada in the journal Phytotherapy Research. And they reviewed 50 studies on grapeseed extract, and it was a significant improvement in blood sugar, fasting blood glucose, total cholesterol, and the bad one, LDL cholesterol, triglycerides, another kind of greasy fat that contributes to heart disease and stroke risk, and inflammation in the heart, and people with metabolic syndrome. So now I'd like to discuss grapeseed extract for blood pressure. This is the British Journal of Nutrition. It's a Center for Nutrition Research, Illinois Institute of Technology, and also the University of California, Davis. In fact, the University of California, Davis performed a number of studies along this line in people with metabolic syndrome. Metabolic syndrome, again, is a cluster of issues, a cluster of conditions. These people had high blood pressure, elevated blood sugar, obesity. Many of them had high triglycerides. A number of things that leads to disastrous health, shortened lifespan, numerous trips to the doctor, tens of thousands of dollars spent on prescription drugs. So in people with metabolic syndrome, grapeseed extract absolutely improved their blood pressure. But it also improved measures of blood sugar control within just 6 weeks. So it was a randomized, placebo-controlled human clinical trial. Grapeseed extract 600 milligrams a day versus placebo over a 6-week period. And it improves systolic blood pressure between 5 to 6%, and it reduced diastolic blood pressure 4 to 7%. That's a real winner. Systolic blood pressure is when the heart is actively pumping out blood. It does that a little bit over 100,000 times a day. Diastolic blood pressure is when the heart's getting a little rest. It's in between beats and the heart is refilling with blood. Now, mind you, the heart is pumping every second and a half. Every 3/4 of a second. Every 3/4 of a second, 80 times a minute. Every 3/4 of a second. So if that bottom figure is elevated, it puts a terrible load on the heart. It inflames the heart. It puts the heart under a lot of stress. It really increases the risk of a heart attack and building up plaque in the arteries and damaging your blood vessel walls. So lowering that bottom figure is a winner, and they've shown this in a number of studies. So 4 weeks after stopping the grapeseed extract, their blood pressure went back up to normal, to elevated. Normal for them, which was elevated. By the way, the grapeseed extract also improved their fasting insulin sensitivity within just 6 weeks. These are markers of improved blood sugar control. Now, we use Innovita grapeseed extract. It's from a French-Italian consortium. It's from the pip of the white grape. That has more of the OPCs in the correct form. And when they did a study at the San Valentino Vascular Screening Project up at Gabriele D'Annunzio University, that's above Bari, Italy. Bari, Italy is where people take the ferry across the Adriatic to the Greek islands. And if you speak to people from Bari, Italy, in an unbiased way, they'll tell you it's the most beautiful city in all of Italy. In any event, these people had mild hypertension. They gave them grapeseed extract. Within 4 months, 93% of the participants, their blood pressure was restored back to normal, just using grapeseed extract. So here's the the University of California, Davis once again, they've done multiple studies of patients with high blood pressure and metabolic syndrome, and the grape seed extract significantly lowered blood pressure. And I want to tell you, we actually covered this in a separate podcast. There's a separate podcast talking about grape seed extract and other nutrients for high blood pressure. So now, let's go to a quick break. When we come back, we're going to discuss vision issues in people with diabetes and what grape seed extract can do for them.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Okay, welcome back, pharmacist, nutritionist Jerry Hickey, Invite Health Podcasts. We're talking about grapeseed extract for people with diabetes. In the first episode, we discussed how grapeseed extract safely helps improve blood sugar control. And just now, we discussed grapeseed extract for blood pressure. Now, let's discuss the eyes. Diabetes is a leading cause of damage to the eyes and loss of vision. One of the things that occurs in diabetes is diabetic baby cataracts. They're sorbitol cataracts. And grapeseed extract does seem to reduce the risk of that. But more importantly, it helps with something called diabetic retinopathy. Diabetic retinopathy causes vision loss. About 80% of people with diabetes at the 10-year mark, 10 years after being diagnosed with diabetes, develop some level of diabetic retinopathy. So it's rather common, since so many tens of millions of Americans have full-blown diabetes. And diabetic retinopathy is damage to the blood vessels in the retina. It leads to vision loss. The retina is where you see. It's where the rods and the cones are. It's where you distinguish color and vision in general and night and day, light and dark. And behind that is the choroid body that has these numerous tiny little blood vessels called capillaries. They're the smallest blood vessels. They're so narrow, they're only the width of one red blood cell. And in diabetic retinopathy, these blood vessels become fragile and they break, and they're scarring, and it can lead to vision loss. But you also develop something called hard exudates. Hard exudates are a buildup of fatty deposits in the eye. It's a dangerous thing. So this is the journal Medicine. It's a randomized multi-center trial. 124 patients with diabetic retinopathy between the age of 40 to 78. They were prescribed a drug. The number one drug for treating diabetic retinopathy is calcium dobisolate. Calcium dobisolate is a venotonic. It's for capillary fragility and capillary permeability. Fragility means these little blood vessels can break, and permeability means they're leaky. So they gave them either grapeseed extract, 150 milligrams a day, or calcium dobisolate. Normally you give 500 milligrams 3 times a day. And it really made a difference. All the patients had retinal damage. All of them had thickening of the retina. They had the hard exudates, the buildup of fat globules in their retina. Grapeseed extract was actually superior to the drug that's prescribed for protecting the eyes from diabetic retinopathy. It reduced the total macular volume. The swelling in the eyes was decreasing. It significantly improved the number of hard exudates, the severity of it, these fatty globules in the eyes. It was helping the permeability and the fragility of the capillaries, and it was extremely safe. It really is something that's been shown in a number of studies to be good for vision, the blood vessels in the eyes, the retina of the eye, even night vision. It is a pigment. Pigments help with certain pigments can help with vision at night, and with very sharp vision. You know, the kind of vision you need for looking at something and focusing on it at sharp details. Now, what about chronic kidney disease? There's a number of leading causes of chronic kidney disease, autoimmune diseases like lupus, systemic lupus erythematosus, high blood pressure if it's severe and not controlled. But the number one cause is diabetes. I read a report, an article in the Sunday Times magazine, it had to be 5 years ago. And they were talking to the director of a major hospital, a university hospital in Manhattan, in New York City. And he said at any given time, 70% of the patients in our hospital are due to complications and comorbidities resulting from diabetes. So people with eye disease, people who've had a heart attack, people with a stroke, people with Alzheimer's disease and other forms of dementia, people who have severe kidney disease and are on kidney nephrodialysis. Nephrodialysis is a machine used to clean your blood because the kidneys can no longer effectively do it. People with severe nerve pain. So this is grapeseed extract for people with chronic kidney disease. In animal studies, a bunch of them, grapeseed extract increases the glomerular filtration rate. Now, what's that? That's a test of how well your kidneys are functioning, how much blood is passing through your kidneys every minute. Now, a normal glomerular filtration rate is over 60. Like the last time I had my checkup, my yearly checkup, my glomerular filtration rate was like 98. It's perfect. For a guy my age, 66, beautiful. If your glomerular filtration rate's below 60, you're starting to lose kidney function. And if it goes 15 or less, you put on a machine to clean your blood. You put on kidney nephrodialysis, which is not pleasant, and it increases your risk of a blood clot. And it inflames your blood. So in animal studies, a number of studies, grapeseed extract improves the filtration rate of the kidneys, the glomerular filtration rate, and it reduces inflammation in the heart and the kidneys. So this is the journal Experimental and Clinical Sciences. It's from the University of Carthage. And these are people with chronic kidney disease. The other name for chronic kidney disease is chronic kidney failure. So it's a small study of people with chronic kidney disease. They gave them a lot of grapeseed extract every day. They gave them 2,000 milligrams. I've never used anywhere near that on my clients. Versus placebo for 3 months. And they were okay with this high dosage. Grapeseed extract improved the glomerular filtration rate, which was astounding to me. But I've seen other studies like this. I saw a separate study, in older women who were obese with high blood pressure. They were postmenopausal. And when they gave them grapeseed extract versus placebo, it prevented a drop in their kidney function associated with aging. The aging process decreases kidney function also. It's a common occurrence. So they saw that the women on placebo, they were losing kidney function. The women on grapeseed, they retained their kidney function. That was a very interesting study, but let's get back to this one. This is people who have chronic kidney disease. They gave them grapeseed extract every day for 3 months or placebo, so it's a state-of-the-art study. Grapeseed extract absolutely improved the way the kidneys work. They were filtering better. It decreased proteinuria. So let me explain what that's all about. Your kidneys are filters. Before I explain this, let's go to another quick break. We'll be right back. Jerry Hickey, Invite Health.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Okay, welcome back. Pharmacist nutritionist Jerry Hickey. We're talking about grape seed extract for people with diabetes and what it could do for their kidneys. Your kidneys are filters. They filter out toxins and excess fluid and excess salt and excess electrolytes, and this is called urine, and they keep back the good things like protein in the blood. So the kidneys have millions of little filters called nephrons. And the glomerulus is filtering the blood, and then the tubules separate the good from the bad and create urine or restore the good things back to the bloodstream. In diabetes, the inflammation from all the sugar is inflaming these tubules, and they're becoming leaky, and protein is starting to leak into the urine. One way you know if you have proteinuria, which means excessive protein in the urine, is that you'll see foam in the urine all the time. I mean, if you see foam in the urine once or twice, that could be something you ate. But if you see it all the time, I would check with my doctor. So this is the University of Carthage. It's the journal Experimental and Clinical Sciences. They gave people grape seed extract or placebo every day for 3 months. It improved glomerular filtration rate, and it was reducing the amount of protein in the urine, proteinuria. But it also restored the blood antioxidant systems, SOD and catalase. These are like first responders to reduce cellular inflammation in the kidneys and the liver and the heart and the brain and the eyes. It's a wonderful finding. It reduced lipid peroxidation. Lipid peroxidation means that the related to the kidney damage, there was the fats in the body were going rancid. That's bad because this is a catch-22. It's a sequela of events that damages organs and tissues because that lipid peroxidation just grows and spreads. It's a chain of events. It reduced carbonylation. That's damaged structural proteins caused by elevated blood sugar. It also reduced inflammation in the heart, what we spoke about before, CRP, C-reactive protein, a proxy for inflammation. It reduced triglycerides, a kind of greasy fat that contributes to stroke and heart attack. And it blunted anemia. That's important. When you need more oxygen, your kidneys release a hormone called erythropoietin, and this causes the bones to create more red blood cells and hemoglobin to carry more oxygen. And people with chronic kidney disease, the kidneys can't release the erythropoietin, and you wind up anemic and fatigued, etc. Anemia could be quite dangerous, by the way. Okay, so that wraps up episode 2 of Grape Seed Extract for people with diabetes. So far, we've discussed in episode 1 grapeseed extract for lowering sugar. In this episode, grapeseed extract for high blood pressure, for kidney disease, and for vision health, retinal health. In the next episode, we're going to discuss grapeseed extract and the heart and plaque in the arteries, a very important point. Thank you for tuning into the Invite Health Podcast. You can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Please subscribe and leave us a review. You could follow us on Twitter, Instagram, and Facebook at Invite Health. Hope to see you next time on another episode of the Invite Health Podcast. Thank you so much for listening.